afternoon, everyone. My name is Maipelo Tsuaneng, a representative from Botswana Harvard Health Partnership. This is my first time presenting at a conference. And I'm really excited to be here presenting the findings from our study, base study. And I'm going to be, our study is focused on screening for depression among adolescent girls and young men in Botswana. I have no disclosure to report. Next. On the background of our research, adolescence is a critical period of emotional and social development, but it is also a time of increased vulnerability to mental health challenges. For adolescent girls and young women, factors such as gender inequality, limited access to health care, stigma, particularly around sexual and reproductive health, can make things even more challenging, as that can hinder their ability to access, seek, and use health services. In Botswana, we have little data on the mental health status of this population, especially those who are accessing SRH services. Our aim in this component of base study was to better understand the prevalence and the severity of depression among adolescent girls and young women in Botswana. Next slide. The Botswana Adolescent Girls and Young Women STI Testing and Treatment Study, or base study, is an ongoing project in Gaborone that looks at the burden of sexually transmitted infections, specifically chlamydia, gonorrhea, and trichomonas among adolescent girls and young women. Participants are recruited from 3 public clinics, and during the process, there is a complete risk assessment factor, which includes mental health screening using the PHQ-9 tool. This integration of depression screening into the STI study gave us a unique opportunity to capture mental health needs of this group. And today I'm going to be focusing on the depression screening, whereas the STI results will be presented elsewhere. And next. The PHQ-9 tool, it is widely used, and it is a validated questionnaire for depression. It asks about the 9 symptoms over the past 2 weeks, which, with score ranging from 0 to 27. The response options are not at all, several days, more than half the days, nearly every day, and these responses are each assigned a score from 0 to 3. The tool was administered in English or Setswana, and that was influenced by the participant preference or choice. Next slide. The scores are interpreted as follows: 0 to 4, no depression; 5 to 9, mild depression; 10 to 14, moderate depression; 15 to 19, moderately severe; and 20 to 27, severe depression. In our study, anyone who was scoring 10 or above or reporting suicidal ideation was considered at risk and was offered a referral for counseling. Those with high score or suicidal thoughts are referred for counseling via public health services. Participant characteristics. Between February and July 2025, we enrolled 310 adolescent girls and young women, and the median age was 21 years. 71% had completed secondary school, and nearly all were Botswana citizens, and about 3/4 were students. Next slide. Moving on to depression screening results. Our result shows that 54% of our participants had no depression, 25% mild depression, 15% moderate depression, 6% moderately severe, and 1% severe depression. If you focus on those who are meeting referral criteria, that's PHQ-9 score of 10 or above, or those that are reporting suicidal ideation, we find that 26% of participants fell into this category. Of those offered referral, just over half, which equate to 51%, accepted mental health services, and were referred for counseling through public health services. In overall, these findings reveal a substantial burden of moderate to severe depression in this population, 1 in 4 screen positive for a level of a depression, and that warrants a further evaluation. Sexual and reproductive health clinics could be a strategic point for integrating mental health services. So about the holistic approach, combining STI prevention and treatment with the mental health support could improve the overall well-being and the health outcome of adolescent girls and young women in Botswana. Our next step includes strengthening linkages between the SRH and the mental health services and scale up the screening in similar settings. And next slide. I would like to end by thanking everyone who made this presentation possible. Thank you.